persistent failings, undignified care and requiring fundamental change. Just some of the damning words in the latest report about how we care for our elderly. Julie Jones has experienced this firsthand. Her mother Jean was 84 when she went into hospital with a broken hip. She was also suffering from dementia. A month after being admitted, her weight had plummeted to 4 stone. Julie says nurses didn't properly feed her or care for her.
We could hear Mum from the lift crying for water. And as we approached the ward, we could see 5 or 6 nurses sat behind the nurses' station, and they just completely ignored her.
Today's report makes 48 recommendations, including banning patronising language such as old dear and bed blocker, deeming it as unacceptable as racist and sexist expressions. Ward sisters should have the authority to act immediately if they see bad practice or slipping standards. And the bedside manner of students and nurses should be compassionate. If it's not, they should be barred from working in healthcare altogether. Many will see these suggestions as rooted in common sense and common humanity, despairing that they're needed at all. But for the government, it's a way to implement change.
One of the things we're doing is we're going to make sure that we carry on with the inspection programmes that are rooting out poor practice in our care homes and in our hospitals. We're also going to make sure that we start to set training standards and codes of conduct for healthcare assistants and care workers who currently have no training standards whatsoever, which I think is totally unacceptable. And we're going to make sure that we outlaw age discrimination in the NHS, as we know we need to root out that ageist set of assumptions that all too often get in the way of dignified care.
With an ageing population, elderly care is a burning issue. Getting it right requires more than reports and initiatives. It's about respecting older people and treating them with dignity when they need it most. Sally Biddulph, ITV News.